Nobody wants a negative health event. You don't want a health scare. You don't want to be diagnosed with anything. You don't want to lose a loved one. But sometimes it happens. And the question becomes usually, oh, this is going to cost me financial future. I'm going to lose income. I'm going to have to spend on health, doctors, surgeries. And it's a negative thing. People get a negative connotation associated with a negative health event, right? But today I want to talk about how having a negative health event can actually improve your financial outlook, and it could improve your financial status, which is counterintuitive for many people, including my co-host Tony Shore, who I'm sure is going to say, no, Dan, this is what are you talking about here? Negative health event improving your financial outlook? Doesn't sound right to me.
And also, I have bad posture and severe financial problems.
Right? Yeah.
Right.
I'm getting older.
Yeah.
Negative health events.
Negative health events. Yeah, I think that, I mean, the older I get, the more I think about negative health events or have them. And I mainly, not myself. I mean, I've been pretty fortunate. However, my parents have had some negative health events and, family that has gotten older. And I see that happen. And it is costly. So sometimes negative health events can be costly. A lot of people think, oh, I'm not worried. When I get older, Medicare will take care of any health care I need. And that's not necessarily true. But I don't understand how a health scare could lead to, maybe you have a stroke or you got to go in and you've got some issue. How could that lead to a better financial situation? That's what you wanted to title the show today.
Yeah. And I think it is counterintuitive because most of the situations, and I looked to find if I could find any research on this to back up my theory. And I couldn't. I didn't look very long. I'm not a researcher, but I Googled
because
it.
maybe your theory is cuckoo.
It could be. I'm going to tell some stories of some people, but getting a bad diagnosis doesn't normally improve anything. But we've done shows on how lotto winners kind of change their life, and sometimes it's negative. So look at it that way. It's like, how can you have a negative situation by winning $100 million? You could see how things can go negative. Sure. But the same can be said at the opposite. If you have a negative health situation, maybe the positive outcomes. Because most people, when they look at a negative health situation, they see it as a financial burden. I've just been diagnosed with a chronic health condition. I'm going to have to spend big bucks on home health care. My husband's diagnosed with dementia. I'm going to have to figure out aides to come in, or I'm going to have to put him in a facility. Or we lost income. I lost my spouse, and now my Social Security's cut in half. What am I going to do? Right. But I'm going to do a quick story of a couple of different clients and get your take on this. So 2 clients, similar age, similar background, both grew up without money, not poor, but we'll just say middle class. And and they both became successful after college. They graduated college with student loans. They made a name for themselves. One was in medical field and the other in business. And I've followed them throughout. So I've known them throughout. And one of them, we'll start with the business guy. Lately, he's been putting in positions of power, and he's moved up on the food chain, and he's made money, significant amounts. And the conversations were, well, if I make so much, then I can retire, right? And what's the number? Let's just say if I make $3 million, then I'm calling it quits. And then you get to that point where the 3 million's right there. And it's like, well, if it's at 5 million would be where I could really call it quits. And you get closer to there. And now it's like, well, if I can make 5 million, why couldn't I make 10? Why not 15? And so it's never enough. And we've done shows on that. I'll put them up here above Tony's head for the viewers on YouTube about what's enough? Is there ever enough? And so let's go to the other case where same thing. didn't come from anything extravagant, worked his way up, paid off student loans, earned money, moved into a position of power, and is now in a position where the money he's facing a situation where he's doing something with his employer that he's not really excited about, doesn't enjoy it. It's not unethical or illegal, but he just doesn't get a good feeling about it, doesn't like the conversation he has to have with employees, and just wants out. The problem is that he's in a situation where if he leaves right now, he's foregoing at least $1 million, more like $3 million. If he can hold on for a year and a half, 2 years, he'll get most likely at least $1 million, more closer to 3.
Wow.
And he doesn't have enough money where that's insignificant. Oh, 3 million, who needs that? It'll be a big portion of his net worth. But he made the decision to say to his employer, I'm done. I don't want to do this anymore. I'm willing to walk away from a guaranteed $1 million. So what's the difference between these two? And I'll say that the second one, that walking away, had a health event prior. He had a near-death experience, survived, but is now living with a reduced life expectancy, unknown, but we'll say that living into his 80s is probably not going to happen. We just don't know how long he's going to live, right? And she's open about that. And I've had conversations about this with him, and he said, you know, you get to a point where you have so much, you know, an income and enough money where you feel like getting more doesn't really move the needle much. But he still had that mindset of, I can make more and do it. It wasn't until after his health event where his life expectancy was at stake and changed that he then changed his attitude about finances. And if I compare the two of them in similar spots, I would say even though his decision-making is going to result in less financial gain, I think he's in a better mindset. And I think it has to do with the fact that he went through a near-death experience and has a reduced life expectancy. His perspective has changed, his timeline has changed, and his values have changed. He no longer looks at the money and says, oh, I can make more. I can get an extra $3 million. That's great. I love it. He looks at it more of, well, what is that going to do for me? What does that really mean? And I think that the health scare really was the deciding factor for him. I can't prove that, but when I compare it to other people and other clients I have, I think that a health scare really changes their perspective about money in a positive way.
Yeah, I suppose it could change aspects of your life in a positive way. I mean, it's sad that you have to go through a healthcare crisis or a health scare, as you call it, or have something like that happen. We don't want that to happen, but if it does, there can be positive outcomes in how it changes your perspective, right? The way you see things might improve, and you might see things appreciate what you have rather than just chase the almighty dollar. And I think that's a sentiment that's rare coming from a financial advisor. That's why you're not finding that online. People don't ever want to say that, like, hey, this tragedy, you know, can lead to, there are good aspects, and people are like, oh, wait, why would you say that? That's terrible to say that, you know, this person having a near-death experience or having health issues or knowing he's not going to live, you know, for that many more years, that's not good. Well, you know, it does change your timeline, your perspective, and your values, which can all affect you financially for better and worse, I think.
Well, it could change it for the worse too. Yeah. But I'll give you some more examples. Like if you lose a spouse, I have a lot of clients that lose a spouse, and the initial, you know, reaction is, you know, anger and disappointment and sadness. But over time, they start to see, okay, I can get through this, and now I'm not going to let that happen to me. I'm not going to not do what I want because tomorrow's promised to no one, and I might as well do it. I have recently, some clients diagnosed with cancer.
Hmm.
Out of the blue, we're talking early 60s. What's changed? Now, we've had conversations in the past. Hey, we're planning for this and we're going to work till this and everything's great. We could do this. Now the math has to change because they're saying, I might not live to 70. What am I working for? And so, of course, it's negative, right? You don't want to die early.
Right.
But financially, their values and the timeline has changed. And now it's, well, why don't I do that trip? Why don't I spend and buy that new pair of, a new car that I've been dreaming of? Because time is short. And I think that's a positive. Way too many clients, and financial advisors focus on, all right, how do we prevent against long-term care need? Let's sock money away in case you live into your 90s and you need extra money. You don't want to be destitute, because people don't want to be destitute. But that fear-driven financial planning of outliving your money doesn't work. It works for most people, but when they have a health scare, they say, well, no, let's back off a bit. Maybe I just lost my wife. Maybe I'm not going to go to 90. And if I do, who cares? I wanted to go to see the pyramids with my wife and I couldn't do it. I'm going now. And be damned if I'm going to not do it because you're telling me I might run out of money when I'm 88. I'm 65 now. I don't, so that delayed gratification, which is something that helps people have enough money, sometimes it works against you when you are younger in retirement and you're holding back on doing the things that are important to you because you're afraid of running out. I think a health scare can totally change that for you.
Most advisors push their clients to not spend any money. They would tell you, do not spend your money. And most financial advisors tell you that. And they use the excuse and that fear of running out of money in retirement or running out of money before you pass. And that is why people, okay, I've got to listen to this financial advisor. That's true. I don't want to run out of money, and he's going to help make sure I don't. But a lot of financial advisors, and I know many of them, are telling people, do not spend a dime of your money. You need to plan for your monthly expenses, but be careful. If you want that new car, no, maybe get an older used one. No, don't spend too much of that money. And they have selfish motivations, right? Because they're getting paid a fee on how much money that person has invested. And if that person is spending that money, then they're drawing down that investment quicker, and the advisor doesn't make as big of a fee on that person. So I have known some advisors, my mother-in-law's advisor for one, who tells her never to spend a dime on her grandkids. She wants to, and she says, I just can't because my advisor tells me I'll run out of money. She's 86, and he's telling her that right now. And she's saying, I want to do things for my grandkids. And he told her. And I told my wife to tell her, no, that advisor is giving horrible advice. And that is simply, she has plenty and she's not going to live forever. She's not going to run out of money if she withdraws whatever. I'm not going to go into the figures, but it's obvious that she could spend money on her grandkids without having to worry about it. But this advisor has her scared. And it's all because he gets to keep that whole amount, earning his fee every year. He gets a fee every year, right? Am I right on that, Dan, or not?
Yes, you are. A lot of financial advisors, myself included, charge a fee to manage money.
Sure.
And so it's counterintuitive.
But that makes sense.
But I'd rather my clients be happy spending their money, and I say this openly to clients, and we've done shows on this, how a lot of times I struggle to get people to spend their own money, right?
Yep.
And so the idea is, well, let's put it in perspective for your mother-in-law. What's going to make her change her attitude? Obviously, the advisor pushing her might, but it might not. She might not want to spend it anyway, and she's using the advisor as an excuse because she saved her whole life, right?
Yep.
Would a health scare for her change her attitude about money? If the doctor said you got a year to live, would that open up the floodgates for her to do what she wanted to do or claims to want to do, which is spend money on the grandkids?
See,
The
that's
people
the
that
point.
spend money on long-term care insurance are usually the ones that had to take care of their mom or dad. And they're like, I don't want to do that to my kids, so I'm putting money away for that purpose. The people that come to me and say, like my mom, she died at 72. My dad, and I interviewed my mom and dad well before this and said, what would you recommend to people? And they both said, spend money and travel while you're young and can enjoy it. My dad has told me since that he doesn't have regrets of not having a lot of money now because they spent it and did trips with my mom when they were alive. Not because they thought she was going to die at 72. It was just because they were young and healthy at the time.
Right.
Thank God they did that, because my mom and dad wouldn't have been able to experience these things together if they didn't do it early. So I try and instill that in my clients. But the question is, do they need to go through a health event in order to adjust that mindset, or can they learn from watching others? And that's what I don't know. Obviously, in your mother-in-law's case, she hasn't learned from seeing other people of her age pass away.
Yeah.
And she's getting that negative reinforcement from the advisor to say, don't spend.
Sure.
Do you think you need to go through a health scare in order to change your behavior? That's the question. I don't know. It helps, I think, change your behavior, but maybe
sure it does.
Seeing a close loved one go through it is enough. Maybe seeing someone else tragically deal with it. We did our previous show on Aretha Franklin and how it's a nightmare of a estate planning situation. Prince, you name it, like famous people go through and everyone sees their dirty laundry. Is that enough for us to say, well, I don't want that to happen to me, I'm going to get my legal documents in order? But if it happened to your father when he died and your grandfather when he died and he had a problem, you're like, I'm not, that was close to home.
Yeah.
So the closer to home the health tragedy is, I think the more it would improve your financial mindset.
Yeah, it has mine. I mean, what happened with my grandfather's estate and what my parents have gone through since then has definitely changed my perspective and made me focus more on, what's important and what I need to get done, right?
I agree. So I'm not telling people to go out and cheer for a health scare, because no one wants that. You don't want to have a heart attack.
Right.
You don't want to get that cancer diagnosis. And I recently had to go through a test that is it cancer or not? And I'll tell you right now, my experience was horrible. That feeling, that unknown, oh my gosh. But like that, and my friends told me, hey, as soon as this clears, it's going to be fine. As soon as it comes back as no issue, you're going to go right back to where you were. This I got to live while I can mindset is easily gone. It's not easy. I'm not saying this is easy, but I'm saying that don't look at a negative health event as just a financial catastrophe, because you could prepare for that. You can have insurance and prepare for a negative health event with the finances, but also look at it as a chance to improve your mindset when it comes to money if this stuff happens to someone close to you or yourself.
Yeah. Good point. Well, a great take, looking at things from a different angle, finding the positive in a negative situation. Dan, you're great at this, and you never cease to amaze me, I should say.
Well, hopefully, Tony, people are picking things up from me and learning from my experiences with others, but you learn from experiences of your family. I'm learning through you as well. It's this, I mean, I keep saying, and I carry the coin with me, and I've shown this before on the previous shows, literally carry this coin that says memento mori, that says, remember, you're mortal, no one's going to live forever. I think that messaging is not something that I take lightly, and I bring it into with my clients, and with you, I learn. You can learn from everybody and learn from everyone's tragedies as well. Learn from everyone's difficult experience, and try and take the positive approach to it. So I try. But thanks for a good show, Tony. I appreciate you as always, and I'll catch you all next week.
All matters discussed in today's show are for informational purposes only.
This show is not investment advice.
Dan Riddle nor Dolphin Financial Group are affiliated or endorsed by any government agency.
Investment advisory services are offered through Dolphin Wealth Management, Inc., a registered investment advisor in the state of Florida.
Insurance products and services are offered through Dolphin Insurance, Inc.
Dolphin Wealth Management, Inc. and Dolphin Insurance, Inc. are affiliated companies doing businesses as Dolphin Financial Group.
You should talk to someone at Dolphin Financial Group before implementing any of these strategies or ideas.